Good day, Ma'am Dal. I hope you're doing good today. My name is Kenneth D. Velasquez from Section 12A, Group 24, and a student nurse from Davao Doctors College. Today, I will be performing my return demonstration in performing Leopold'S maneuver. This assessment is a four-parts process where we can identify the presentation, position, degree of descent, and the attitude of the fetus. We can also determine the number of fetuses and of course identify the points of maximum intensity of the fetal heart zone in relation to the woman's abdomen. So of course, the materials that we are going to use in this assessment are stethoscope, a towel, and of course, a pillow. Completeness and organization of our materials ensures our efficiency as nurses. And after this, we need to wash our hands for us to deter the spread of microorganisms. Of course, after hand washing, we need to introduce ourselves and verify the client's identity and explain the procedures to the patient to gain cooperation. Good day, ma'am. My name is Kenneth D. Velasquez, your student nurse for today. And by the way, you can call me Ken. Before we start, ma'am, may I see your wristband? Can you please tell me your full name, ma'am?
Justin Velasquez.
How old are you, ma'am?
16.
See. So, what would you like me to call you, ma'am?
Justin.
So, Ma'am Justine, how's your day going so far? That's nice to hear, ma'am, and I really hope that our day will end up a good one. So, for today's session, ma'am, of course, we will be doing an assessment called Leopold'S maneuver, and your abdomen will be exposed in this procedure. Would that be okay? Okay, so of course, upon exposure, I will be palpating your abdomen, ma'am, for me to determine the position of your baby in your stomach, okay? So, if you do have any other questions so far, just let me know, okay? So, from this point, ma'am, do you have any other questions? Can I proceed with the next procedure? That's nice to hear. Of course, after that, we will be letting our patient to empty her bladder because a distended bladder may slightly deviate the uterus. Before proceeding with the procedure, ma'am, would you like to take a pee in the CR? Okay, so let me assist you. Just go ahead here. Just let me know, ma'am, if you're done, okay? Of course, while waiting for the patient, we need to position the patient in a supine position. One pillow under the head with her knees slightly flexed and exposed, of course, the abdomen for the assessment. Hello, ma'am. Are you done? Okay. Just here. Okay, ma'am Justine, just like there. And can you please flex your knees a little bit for me? Just a little, ma'am. Okay, ma'am. So this is the part where I will be exposing your abdomen, okay? So I will be asking you now, is the temperatures okay? Are you not chilling enough? See. Is my hands cold enough or not? Okay. Just let me finish up this one. And of course, as you can see, this will facilitate accurate measurements and this will provide comfort to our patients. Flex knees to relieve tension of abdominal musculature. So if you are right-handed, you need to be on the patient's right side, facing the woman. Since I am a left-handed person, I am in the left side of the patient facing her. And after that, we really need to consider this being on the left side means to easily grasp the symphysis pubis to be done in the third maneuver. So for the next step, of course, we need to place the rolled towel under the patient's right hip to shift the uterus away from large blood vessels and prevent supine hypotensive syndrome. Good day, ma'am. I'm just going to place this here. Can you please move to my side, please? Just a little bit. Okay. Are you comfortable with that? So, of course, from this, we can now start with our first maneuver, or the one they call the fundal grip. Here, we need to face the patient and palpate the uterine fundus for us to determine whether the fetal head or the breech is in the fundus. Okay, ma'am, so this is the time that I will be placing my hand to your stomach, okay? So just let me know, ma'am, if you're not comfortable enough, okay? Okay, so the head feels hard and round, freely movable and ballotable, while the breech here feels softer and nodular. So after this one, we can now proceed with the second maneuver, or the one they call the umbilical grip. Here, we will be palpating in a downward direction on the sides of the abdomen, applying gentle but deep pressure for us to determine the fetal extremities, the fetal back, and the anterior shoulder. Okay, so let me rub my hands again, and we'll be placing again my hands down, okay? This is just a while. Softer but deeper. And the fetal back here feels like a long continuous structure, but if it is now nodular, then it reflects the portion of fetal extremities. So after this one, we can now proceed with the third maneuver, or the one they call the Leopold'S grip. Here, we need to place our one hand, or our dominant hand, over the symphysis pubis and grasp the lower uterine segments between the thumb and the fingers to feel the presenting parts and if engagement has occurred. Okay, ma'am, so let me rub my hand again, and can you please think this one? Okay, so here, if the presenting parts is movable, it's not engaged. So lastly, we can now proceed with the one they called, or the fourth maneuver, or the pelvis grip. Here, we need to turn and face the woman's feet, of course, for us to confirm the findings from the third maneuver and determine the flexion of the vertex. So here, let me rub my hands again. We need to face the woman's feet, as I have mentioned a while ago. I will be placing again my hand, ma'am, okay? So here, the cephalic prominence is felt on the side where there is greater resistance to the descent vertex. So let's finish this assessment, of course, by locating again the back of the fetus and listen for the fetal heart tone for 1 full minute using a stethoscope. Okay, Ma'am Justine, so now we are quite in the end with the assessment. I will be using this stethoscope, okay? So for us to prevent any contamination, the spread of contamination, let's clean this one with a cotton ball. This is dry cotton ball. And of course, we need to take note that using the bell of the stethoscope will help us to have a better auscultation. Okay, so Ma'am Justine, can you please put your hand here? So I will be placing the bell in the left lower quadrant of the abdomen of the patient. Hello, Justine. After 1 full minute, I auscultated 127 beats per minute, which is normal for the baby, okay? So, of course, normally fetal heart tone ranges from 120 to 160 beats per minute, but there are other books like the Book of Pillitary that aforementioned that the normal fetal heart tone starts from 110 to 160. Of course, here we need to note the location, rate, and the character of the fetal heart zone. For you to be informed, ma'am, the heartbeat of your baby is located in the left lower quadrant, okay? And it has 127 beats that I have aforementioned a while ago. And that is normal heartbeat for the baby, okay? So next we need to make the patient comfortable to ease and promote relaxation. Ma'am Justine, I would like to let you know that this is the very last part of the assessment. I will be putting this one in the medical hamper. And then I'm going to place this one back. Then you can now just stretch your, go back there, and then here. Okay, so are you comfortable? So lastly, we will be documenting the observations made, just like the fetal heart rate position, attitude, or whether engaged or floating, because documenting is important since it promotes a database for future. This is the last. This is for documentation purposes. Hello, Justine. After doing the procedure, I have determined that your baby is at your right side and that your baby is in cephalic position, ma'am, which means that the head of your baby is at the lower part of your uterus and is already engaged. This is an ideal position of the baby for labor. And of course, ma'am, I think this will be the last part of the assessment. Do you have any other questions so far? That would be nice to hear, ma'am. And I am really looking forward for the delivery of your baby soon, okay? Okay. So, I think that will be all for the Leopold'S maneuver assessments. Again, my name is Kenneth Velasquez from Section 12A, Group 24. And thank you very much, Ma'am Dal, for watching. Goodbye!